I think we're all set to get started. I'd like to welcome everybody. I'm excited to have everybody joining me today to share my insights on how we can reopen our businesses while also removing the risk of potential outbreak within our workforces. This is something that's been a top of mind for many of us globally, and there's already plenty of research coming out of firms like Gartner and Verdantix, as well as government agencies like the CDC and federal governments like the Government of Canada on this topic, and they're all putting out, various risk reduction methods in order to help us move forward into the new normal. Before we get started, I'd like to let everyone know that you're muted, but feel free to drop any questions in the chat box below on the sidebar, and we'll try to answer them at the end of this webinar if there's time. If there's not, we'll definitely circle back with you afterwards to make sure that we can answer any of the questions that you do have, and we can go from there. Also, before we get going into the actual presentation, I'd just like to introduce myself and let you know my story and where I'm coming from and how I got into safety. When I was young, my dad was working at a meatpacking facility, and his job was to load trucks with product. One day he was loading pigs into the back of a truck, and for some reason, or one of the unknown reason, one of the lift systems busted and broke, and so the pigs were no longer able to be lifted mechanically and had to be hand tossed into the back of the truck. And so, seeming like it wasn't that difficult, to do a couple of pigs, he started to work through the mound. And what ended up happening was it wasn't just a single pig that ended up hurting him. It was after a full day of work, and it just took one rather large pig compared to the regular load size to have him compress or herniate his disc in his lower back. He did that when he was 23 years old. And unfortunately, what ended up happening after that is just a ripple effect throughout my entire life that I've had to deal with by proxy of my father. And so, witnessing this firsthand, I've seen what happens with workplace injuries and how easy it can happen, and it's in a blink of an eye, and it's never ever planned. It's always an accident. And so having to deal with surgeries and chronic pain and workers' compensation for the past 30 years, I wish to avoid that recipe for anybody going through life. And so that's how I kind of got the introduction into safety. I started working as a career risk engineer in functional safety engineering earlier on in my career. I extensively promoted the use of preventative measures to reduce risk as opposed to mitigation tactics, as it's always easier to prevent an incident than to actually mitigate the consequences of that incident. And so this current pandemic tends to grab all of my experience and kind of culminate it all together, dealing with occupational health and safety, as well as functional safety engineering and risk analysis. Moving on to SafetyTek. Craig and I founded SafetyTek with the purpose of supporting workplace safety by making the mandatory processes that are related to workplace safety simpler to access, simpler to implement, and simpler to track. We also want to make sure that we're engaging workers in a positive safety culture, because that tends to help everybody get behind and rally behind a common mission, common goal of making sure everybody stays safe, but also leverage the state-of-the-art technology to reduce the carbon footprint. We want to make sure that we're doing whatever we can. And so Craig and I both worked in the field, and we know firsthand how safety is viewed by plenty of workers. Craig worked as a construction safety officer for years and constantly battling field workers' views of what safety is and who it's for and why it needs to be done. And the conclusion was that we found workers feel that safety is really not for them. It's for the company or for the government, and they just need to do it as a liability waiver as opposed to actually risk reduction measures. And so we wanted to flip that around and change the stigma behind safety. And so that's what SafetyTek is really all about. For today's webinar, what we're going to do is we're going to go through the key considerations and the critical actions to take for getting back to work post-COVID, or during COVID. The next, we're going to discuss the appropriate measures to reduce risk for workers and how layering risk reduction methods can actually overall reduce your risk more than any specific layer of protection that you want to put in place. Then we're going to discuss how we're helping, as a software firm, how we're helping through symptomatic tracking systems and dashboarding systems that we're making available to you, and we're continuously evolving and iterating on these things as more information comes to light and as more people use it. We want to make sure that we're keeping up with the trends that are happening. At the end, I'm going to summarize everything, and if there's any questions, well, I'll be sure to address them at that point in time as well. But I want to summarize what we're going through, and kind of, there's a lot of information, and so I don't want to overwhelm anybody by going through this too quickly. So I just want to make sure that everyone's aware as well that they're going to receive this presentation and the video afterwards, so that you guys can review it on your own time whenever you're looking for it as well. So the current state of the world is unprecedented, and it's not lost on anybody. We need to all reduce stress by acknowledging that nobody alive today has ever had to solve a problem like COVID-19. I mean, sure, we had the Spanish flu in the early 20th century, but it wasn't amplified by the economies of scale that we have. So before we all get too overwhelmed about what needs to be done, we need to first take solace in the fact that we're all going through this at the same level of experience. Never before has health and safety been such a priority for any organization at this point in time as well. In every single industry, regardless of whether your work is risky or not. We all cater to high-risk market verticals like construction and utilities and oil and gas industries. Workplace safety has been well established because of the high risk associated with those jobs. But we're seeing an increase in verticals now that we never thought we'd really be talking to: salon owners, banking, retail stores, and other low-risk organizations. So this is a problem for everyone, and we all have obligations to satisfy both moral and social requirements as well as regulatory requirements. And so we want to make sure that we're encompassing and gathering everything that we possibly can to have a comprehensive solution in place when we go back to work, and that we're meeting all the requirements at that point in time. So organizations must take significant steps to prepare workers for re-entry into the workforce, preparing and adapting the workplace itself in readiness, as infections are still widespread through much of the world, and they're continuing to grow. I mean, some regions have managed to flatten the curve, but not everyone has. Once workers do return to work, there are critical actions that need to be undertaken to reduce potential exposure and limit the risk of a new outbreak. So these key actions, I've summarized all 12 of them here, and again, don't get overwhelmed by maybe not understanding or knowing what they all are. I'm going to go through each one of them in detail. But the big thing here is that we want to do as much as possibly can without spending a whole lot of money or like putting in a bunch of infrastructure into place, because it's temporary. It's not going to be, it may be for the next 1 year or 2 years, but it's not going to be long term. So we want to make sure that we're not overreacting as well. It may potentially look intimidating, but we'll dive into each one of these and I explain what they all mean. And then again, afterwards, you're going to get copies of this presentation so you can kind of reference back as you see required to make sure that you're meeting all the different risk mitigation tactics that you possibly can. All right. Before I get into the 12 actions and I'm trying to highlight everything, I'd like to just take a poll to find out when you guys are all planning on getting back to work. You may already be back at work, you may not have ever paused, or you may not be sure yet, depending on your regions. We have people from all over the world on this webinar, so I want to make sure that we're able to talk to you guys around your timelines. Various governments have different plans, it seems, and so if your region's impacted more, you may have a different timeline than others who might be trying to open today. I know for my region here, where we happen to be up in Canada, most of our organizations are opening on Monday, June 8th. And so this is perfect timing for when, actually it's a little bit, we wanted to be a little bit earlier, but it's good timing for pre-opening. At least they'll be able to go and catch any risk mitigation layers that they may not have caught earlier on. You know, after 6 months of economic and industrial disruption caused by COVID-19 globally, countries are beginning to return to work and reopen businesses that have been, I mean, technically shuttered to a halt. China's been reopening factories and easing restrictions on travel. Other countries are looking to follow suit as regionally the new infection rates happen to be flattening depending on if you're a low density population, for example. While we may be eagerly anticipating returning to business, people in leadership positions need to take action and to ensure that the workers are protected. We need to do everything in our power to make sure that we're not exposing them, because this is, again, from a social perspective, they're going home and they're interacting with their families, and then their families have social circles, and then so we're impacting more than just the worker itself. And we want to prevent any exposure while the pandemic is still active. So, all right. Everyone have enough time to answer the poll? We'll go back to see the results here. So it looks like everyone's looking to open or already back on site at this point in time, or else in the next 3 months. And so that's perfect. I mean, even if you're already back on site, I'd like to reiterate or to iterate now, I suppose, the risk reduction methods or the strategies or the layers that I'm going to be identifying here. It's not too late to implement them. It's just ideally, if you could have put them into place prior to opening, then that would have been perfect, but not a big deal. You can still go through and just make sure that everything's in place now. So not to be concerned. All right. So first layer of protection is proper sanitization workplaces. So before workers re-enter the workplace, it's pertinent to perform a deep sanitization of work surfaces and remove any potential contamination. In April, the CDC released an interim disinfection recommendations stating that all facilities with a documented illness may have occurred, or where a documented illness may have occurred, should undergo a deep clean, after about 24 hours of air circulation and isolation. Facilities that haven't had human occupation for a prolonged period likely don't require sanitization, because the virus only lives so long on surfaces. And so you don't probably have to prioritize deep cleaning your buildings or your structures that haven't had any human occupancy for more than a week or so. The virality is dropped. Super important, ventilate. Make sure that once you do the sanitization, you've opened your windows, you put fans in place to make sure that you're moving air through there, so that we don't have any residual or potential residual of virus that could be left behind, as well as just the sheer risk of fainting if some of the sanitization chemicals are a bit strong. Reconfiguring workplaces. This is, we all heard of the term social distancing by now. It's not a new term. It's been used in multiple outbreaks, as well as in movies about pandemics and various documentaries. Really, all it means is to increase your own personal space. So in the case of COVID-19, the CDC recommends a 6-foot radius or a bubble around you. It's not that the virus only travels 6 feet and then stops. It's just that the further out you are from your direct personal bubble, someone's less likely to get a droplet landing on them if you are talking, or if you sneeze, or if you happen to cough. It's very important to communicate this to your workers in terms of a policy. Go through your floor plans, identify how many 6-foot bubbles you can safely insert into the space. Physically move workstations so that they're inherently safe, so that workers don't have to think about the social distancing concept. They're just inherently in place already. Communicate the rules for shared spaces within your organization as well, making sure that you've identified spaces where it's very possible to have high density, like a lunchroom, for example, and try to stage the occupancy in these spaces to keep them from getting crowded. Observe the new rules and ensure that your staff are in fact compliant. You want to use smart systems to automate the tracking if you can. Use your security system. Use a key, if you have key card access, for example, you can track incoming and outgoing individuals. Maybe not outgoing, but specifically incoming. And then on timelines, you can see how many people may have been occupying that space at any given time. Or, while reconfiguring the space, be sure to have spaces in a clear line of sight for managers so that they have visibility into those spaces specifically, so they can track through observations. Pre-checks and readiness audits. So before actually opening your doors for business, and again, if you've already opened, it's just a good exercise to run through this anyway. Be sure that the office or worksite reconfiguration actually meets the 6-foot requirements, and that sanitization stations are positioned at the entrance and anywhere where surfaces might be at risk of having collecting a virus. So if you have stainless steel benches or some type of service where the virus could live for more than 1 day or more than an hour, for example, you want to make sure that you've checked that your sanitization stations exist there. If you have a corporate risk tolerance level, you can rank the risk based on your risk chart from low frequency, low consequence to high frequency, high consequence, and everything in between. So as you're making these observations, identify how much risk is associated with a lack of sanitization. Create a daily sanitization station check and make sure that surfaces are being wiped down before and after use. This is again now policy that we want to put in place from a behavioral standpoint. Have employees screen before entering the building, and if you do have visitors, do the same for them. And prior to opening, it should be vital that you have appropriate PPE available for your staff and visitors. And you want to make sure that you check this. Check your stock and make sure that you've ordered any PPE that you may need prior to opening, and then track that inventory tracking itself. Pre-screening employees provides the opportunity for employees to report any symptoms and potential exposure to the virus before entering the workspace. It's now a regulation for all companies to perform a voluntary health check document prior to entering the workplace. However, each state and each region seems to have differing guidelines as to which symptomatic checks need to be put in place. So it all is relevant upon your regulatory authority. So make sure that you've met the requirements for your specific region. Once they start filling out the self-assessments, it'll be key to actually review them and acknowledge that you've done so. This will help you gain long-term participation from your staff and also communicate what would happen if an employee demonstrates too many symptoms. The fear of the unknown is something that we're going to be combating here quite a bit with our workforce, and we want to make sure that we have clear and concise details around what would a quarantine look like. Set up a specific return to work date calculation so that they have all of the details that they're looking for. And without clearly communicating all of the above, your workforce can be flooded with fear, uncertainty, and doubt. All of these steps are built into attempts to make them or help them feel at ease coming back to work. They're not going to know all of the risk reduction measures that you're taking, but they'll definitely be a participant within it. And so anything that you can do to reduce risk, they're going to witness. PPE management. I think I've heard more people talk about PPE in the past 2-3 months than in my collective existence prior to COVID-19. Never in my wildest dreams did I think that news coverage, world leaders, other media outlets would be so willing to talk about PPE, but here we are. And now I'm talking about it. So PPE is such an amazing preventative tool for workplace injuries and has proven effective against virus transmission. Make sure that you have the respiratory protective equipment stocked and available for when you do return to work. Perform fit tests so that workers know what size of mask to wear for appropriate reduction of risk. If they're all wearing masks that are either too big or too small, you won't get the proper fit and they're still going to be breathing in potential virus particles. Add this check to your workplace audits and do your observations regularly so that workers are actually wearing the PPE that's been made available for them. Be sure to track when employees perform their fit tests and when they were taught to how to properly store and maintain their PPE. You want to make sure that you're aware of, from a compliance perspective, that you're doing everything you possibly can to inform your workforce about personal protective equipment and what it should look like. It's different than a set of gloves where, even if you have the wrong size of glove, it can still protect you. You may be introducing new risks depending on your specific job task, but it's a little bit unique in a way where it has to fit your face properly, and everyone has a different shape, and make sure that you get the right size in there. We're still learning so much about this virus on a day-to-day basis, and unfortunately, we have to learn things with the world as a petri dish, and there's way too many variables to try to control. So new information comes to light frequently. It's going to be incredibly important that you have a method of communicating these updates to your safe work practices and your procedures to your staff. You'll want to make sure that you would track the delivery of this information as well as the reception of the information. It's going to be vitally important that workers are up to speed with the latest information that they could possibly have, specifically to your job tasks. If we don't have change management in place today, source out a mobile app, that can provide real-time updates. This is going to be the new normal moving ahead for the next 1 to 2 years for sure while we're going through this pandemic. So might as well get on front, get up to speed on it now as opposed to delaying or waiting. You know, you also have to now support remote work activities. You know, we're trying to ease our way into working remotely. Some companies are more adept at this, some aren't, and so we want to make sure that that we've thought about this at least at a minimum. And so mobile technologies, mobile applications are now rising to the forefront for anyone trying to work safely remotely and communicate with themselves to a remote workforce. Now the past 6 slides, the 6 slides before this were around, you know, getting back to work. So before you get back to work, here's a few of the things that you should be looking at doing. Again, if you're already at work, you can still look at implementing them, iterate as you need. If you're already doing a lot of them, fantastic. You're ahead of the curve on that regard. For the next 6 slides are the things that need to be going ongoing throughout your operations. It's going to alter your company operation. So health screenings and symptomatic checks are something that will be ongoing for some time until a vaccine or a treatment becomes available. This is really our only defense against COVID-19. The only defense we really have is to avoid getting it. And so for the next year or more, it's going to be the new normal. And we've built, so from SafetyTek's perspective, we built a dashboard and we've made it available in a limited capacity to all new registrations for free, no cost. So feel free to go in, jump in. It's a wizard that'll get you all set up. And what this does is help you flatten your curve, so to speak, within your workforce and identify any at-risk individuals so you can have separate conversations with them. Also about clearly identifying who should be quarantined or who should be working in isolation, or how you can control clusters of employees from working together. And so highly recommend, if it's not us, look for someone else who can help you get consistent monitoring of workers' health and symptomatic tracking. That's going to be a vital piece to your overall risk reduction strategy. The next thing is workforce training. People in all levels of an organization need to know what the new rules and processes are, because the risk lies outside of just your organization. Like I mentioned earlier, your employees' homes and their social circles, for example, are all at risk. And if you look at from a corporate risk tolerance perspective, when you consider your risk for your staff, it's usually you have a lower tolerance level for risk because you have trained staff and you have control around their environment. But when you have to account for external people who aren't in your organization, typically your risk tolerance spikes. It goes way up. You have almost, there's still risk, but you have limited risk that you're willing to tolerate to an external individual outside of your organization. So we want to make sure that we're diligent in confirming that from management down to the entry-level worker, that we're all aware of these processes and that we're trained up to the most up-to-speed information. Communicate. I've been saying that word a lot, and that's because communication at this time is crucial to keeping people safe. Communicate training. It can be as simple as an email with a Word document or with a PDF attached, and request acknowledgement from your staff or from your employees. It can be more sophisticated, that you can send out an auto track system that will track the reception and the sign-offs of this information. But do something, and don't assume that everybody knows the same stuff that you do when trying to get these things up to speed. The training needs to inform workers about the new safe work procedures around hygiene, perhaps new technologies that they're going to be interacting with now. If you've adopted new mobile applications, they need to be trained on how to use them. They need to understand where to access everything. So make sure that the training doesn't just only isolate between new policies and procedures, but also new methods of retrieving this information. Be sure everyone has access to the training as well. Another reason why mobile apps are coming out front and center to getting back to work procedures is that you can access remote workers. Yeah, they all access it the same way as your local workers. You can also then track the reception and everything from there. So make sure that you've gone through and found if you already have mobile apps, fantastic, utilize them. Make sure that you're getting as much value as you possibly can out of them. And don't hesitate to get on the phone with workers as well. Walk through how to access these communications so that they can all be sure that when you put work into something and trying to reopen, that everyone's receiving the same information and you have ultimate source control. Enhanced building access, this is relatively self-explanatory. Depending on how your business operates, make sure you have some sort of process built so that people coming in and out are accurately screened and that occupancy levels are not exceeded. That's part of what you're really trying to do is make sure that you're not cramming your building full of subcontractors or external visitors or just too many people at one time, where your workstations now, because they're all spaced out, can't facilitate safe work for everybody. Taking employee temperature is already a widespread practice in China, across airports, hotels, factories, supermarkets, and train stations. And businesses across Europe and the US are also starting to take employee temperature to identify those that have a fever. That seems to be the common symptom that we're searching for right now, is a fever. And so you can use temperature monitoring to avoid infection spread across staff when you reopen your sites. And additionally, visitor management systems enable you to send visitors pre-visit questionnaires with COVID-19 screening questions to help identify potential carriers before they even enter the building. Again, the best method to protect ourselves is to mitigate or to prevent any contraction of COVID-19. And so we want to make sure nobody can get it. So if it doesn't enter the building, that's one of the best methods of risk reduction that we have available to us. We can use temperature guns, just infrared screening guns to make sure that we're reading accurate temperatures. It doesn't have to be anything high tech like real-time camera systems that detect infrared. It doesn't have to be super expensive. It can just be something that you go to the home hardware and pick up a temperature reading gun. Like it's not a super expensive way to cover your risk. The ability to manage your workforce from home or anywhere in the world has been a trend that's kind of been occurring over the last decade, and now it's only become a necessity due to travel restrictions set up by individual regions. And so it's removed the ability for us to just head to a site or head to an office or go and help guide your workforce through new policy or procedures. So now it's a newer challenge where we need to be more effective at communicating over the phone, through email, or by texting. And the trend's not going to go away. What's going to end up happening is the new normal of reduced travel budgets and an investment in software is going to end up happening. And so we need to start to figure out how to operate in this world so that we can continue for the next while. And we're going to see like the shift is going to be permanent. It's not going to be a temporary shift by any means. There's going to be travel, don't get me wrong. That's not going to end. But for right now, we're not really able to head anywhere, especially if we have international operations. So we want to make sure that we're recognizing the value of digital platforms to remotely plan, deploy, and manage projects in some sort of virtual setting. And I mean, we can see how Zoom and Google Hangouts and all these video conferencing apps have been very, very critical in the execution of this strategy. And here is social distancing once again. Along with PPE, social distancing is set a lot by world leaders and epidemiologists, and it's been an effective strategy to reduce what it's really doing is it's reducing the R number of a virus's contagiousness. And so the R number is how many people on average get infected by someone who has the virus. And anything above 1 is a dangerous because it explains that it's exponential growth. And so the considerations you need to make in order to reduce your risk, and this is ongoing social distancing. Do your employees have close interactions with others? Can you adjust your operating procedures, or have you set up your workplace to facilitate these interactions in a controlled environment? Are those interactions prolonged, longer than 15 minutes? Because that increases your risk substantially. Is your workplace crowded? Do you have work outside, or are you inside? Are you able to open windows to keep fresh air moving in? So all of these considerations need to be put in place for continuing to operate within this pandemic. We want to ask these questions to find out that, just to challenge ourselves, have we put the appropriate measures in place to reduce risk? Observation may not be made until after you've been open for a while. So it's good to continue to ask yourself these questions and make sure that this layer of protection doesn't break down against the spread of the virus, because people tend to get complacent and comfortable, and then all of a sudden the 6 feet moves to 4 feet, moves to 3 feet, and then now we've lost our layer of risk protection, risk reduction. And so we need to make sure that we're continuously reminding people that avoiding the I guess the way that we want to socially interact, and that is getting closer to one another. And so we also don't want to need to have to purchase wearable devices such as Bluetooth beacons and various other high-level technology solutions that track your workers in real time. Those can be super expensive, and we're not trying to invade privacy either. There's a lot of other issues with doing that. And so if we can just put the policy in place and make sure that we have Bluetooth, or that we have social distancing in our operation, that's a far, far superior risk reduction method. And finally, psychological safety. And this is something that is relative to just workplace safety practices in general, but it's even more so amplified today. I put this slide last of the 12 critical actions because it could be considered one of the most important actions to take. And so here you go, you're going to spend all your time setting up for reopening, and you're going to get your health screening in place, and also the social distancing measures and the training requirements, only to have your workers either not follow the rules, or they feel it would slow them down for completing the job. They're going to be non-productive, or they're going to lie on their self-assessments because they don't want to go 2 weeks without a paycheck. This happens in safety. Workers feel the need to skip hazard assessments because they believe it's not productive and there's no valuable output in their mind. And so we need to address this upfront with your workers and your staff as soon as possible. Having the message from top levels of your organization about how important it is to properly implement these new procedures, and that skipping them has a higher consequence than performing them, even if it slows them down. Showcase that you're willing to sacrifice productivity for safety so that they feel confident that when they see a crowded space, they'll say something about it and they won't enter until it's safe. That's how this is going to all work. But if they don't have that underlying psychological safety, then they're going to avoid being non-productive, or what they view as non-productive. And it's been proven over and over again that performing safety activities actually increases productivity because it reduces unplanned work stoppages. But we want to prevent the spread of a disease. Make sure you've communicated your sick leave policy. I know in some countries, like in Canada, for example, the government is assisting employers with 10 days paid sick leave. Make sure that that's communicated to your workers so that they understand that they're not going to have to go 2 weeks without a paycheck. Their main concern is providing financially for their families and providing food for their families and making sure that they're all taken care of on that front, and that they have debt and a mortgage payment, and that they're not going to get kicked out of their house. So those are looking at the psychological aspect of your employees and your staff. Those are the things that they're worried about. So make sure that they're aware that that's not going to happen. Otherwise, you're going to have non-compliance. Let them understand that you know what they value, and that we happen to be in incredibly bizarre times right now, and that the things that they feel or they felt that they were going to be penalized for before, for maybe not working as fast or as quick as they need to, are not things that they need to deal with moving ahead. So let's move on to the practicality of risk reduction, the practical steps. Approaching risk reduction methodology, it's important to know the cost benefit of each layer of risk reduction. On the chart on the right, you're going to see what's called a plateau, an exponential plateau. And the first few safeguards that you implement, for example, social distancing, employee health screening, and PPE, will get you close to that plateau of YM, the line. And anything more that you implement, you may be, maybe you want to purchase or implement some sort of wearable device or something like that. It's going to cost you as much money, but you're not going to see the same benefit from it. And so this principle is called as low as reasonably practicable, LRP. And so we want to recognize that there's no way to reduce all of the risk. New policies and procedures are effective and they cost the least amount of money. as long as they're followed and communicated. So we want to make sure that we're doing everything we can from a policy perspective. Make sure that we accommodate all the high-risk workers, and in this case, for COVID-19, it's the older working population that we want to make sure that we're catering to. We don't want to put them into a dangerous situation intentionally. So if there's a way that we can have them work in isolated environments so that they're not coming in contact with other people, it's fantastic. Ensure that your safeguards are independent of one another as well, and there's no common cause of failure. As soon as you get into common cause of failures, then one thing fails and multiple layers of your risk reduction strategy fall, and that can expose you to risk beyond what you're willing to accept. And so layer all of these multiple methods to ensure that the most risk reduction can be met without the most direct cost. And again, removing that common cause of failure. What that looks like in terms of a visual is that each layer of risk reduction is independent of one another. So that if one layer doesn't work, it doesn't expose you directly to the risk, it just reduces your risk reduction total. So that it would take multiple failures of multiple layers of protection for you to actually realize the full risk. So this is how we can look at the risk reduction model in action. So we're going to put in 7 different layers of risk reduction. Discourage people who are ill from working, social distancing measures, personal protective equipment, sanitization practices, physical barriers, increased ventilation, occupancy control in high traffic areas. The more you put in place, the more risk you reduce up to that plateau. And so if my social distancing measures fails, well, at least I've discouraged workers from coming in who are sick. I still have personal protective equipment to block any water droplets. I have sanitization practices to eliminate any contaminated areas, and so on and so forth. So make sure that you consider this model when you're layering up your risk reduction method. And then tracking symptoms. The purpose of this is to identify potential at-risk employees and take extra precautions to isolate them. So keep in mind, it's allergy season. We also have another cold season going through, and so there's going to be a lot of false positives. And you want to make sure that you identify the people who are symptomatic and don't just immediately send them home. Call them up, have a chat with them. Maybe they're allergic to weeds. So you want to make sure that you're not overreacting to the symptomatic questionnaire. You want to identify the proper questions to be asking as well, but also just make sure that you have a plan in place for people who are maybe symptomatic, but it's due to some other reason. And so you can, rather than sending them home for 2 weeks, you can just put them into modified work duty. While each region has their own set of questions for the symptoms, some of them may be experiencing chest pain, difficulty breathing, having a hard time waking up is a symptom, shortness of breath at rest, having a fever, of course, greater than 100.4 is the mark that we're looking for, and then of course coughing. Typically not sneezing. So, allergies primarily sneezing. So we want to make sure that we're identifying the differences between COVID-19 and just an allergy or a common cold. So in summary, we're all going through this together, and that was a lot of information and it was relatively speedy. And I know that I kind of glossed over a lot of topics as well. The purpose of this isn't to be the end all be all, and the slides in the video are going to be made available for you to review afterwards as well. And again, if you want to revisit anything that I went through, you're able to do that. And any of your questions that you did happen to ask, I'm more than happy to take that offline into email or a phone call conversation. We can have a chat about what your questions might be. The important takeaways, though, is that we're all going through this at the same time, and nobody in the world has ever experienced this before. So don't stress out about it. Just be ready to adapt, be agile, be ready to implement new policies and procedures as they come to light and as you see how you can fit them into your operation. We want to ensure that we've addressed critical actions summarized before opening up. And if we're already open, then it's not too late. We want to make sure that we address them now moving forward. Anything that we can do to layer more risk reduction methods onto another, we're going to further reduce our risk of contracting COVID-19 and controlling an outbreak. Constant communication and training with your staff. That is so important. You don't want to leave your staff open to interpreting your new policies. You want to make sure that they're clear, concise, and compliant to your new procedures. Risk is reduced in layers, so think of it from that perspective. The failure of one layer does not expose us directly to a risk of contraction. It just reduces the overall model until it gets remedied. And then digital systems and mobile app technology can help alleviate the administrative burden of getting all of these systems up to speed and help us with the communication systems that we need to put in place in order to effectively get our staff trained up and make them privy to all of the information that you're putting out there and that you're gathering. You're out here, you're at a webinar right now learning about how this all needs to work. No different for as you're continuing your journey. You're gonna find more resources and you're gonna find more information out around how to open up and how to operate. And so you wanna make sure that as you learn new information, that gets pushed out as quickly as possible to your staff so that they're aware of it. Thank you very much for joining me on this webinar. Very much appreciated. Again, if you need to contact us, you can reach us through our contact us page on SafetyTek.io. Feel free also, I should mention, to join up. We've offered our COVID-19 release in a limited capacity for free. We don't want to impede you with having to get into a commercial conversation around protecting your workforce from potential exposure. So feel free to go register. Start using it and give us your feedback of what you're looking for or how we could do anything better. We're continuously improving and iterating upon this solution. So we want to make sure that that's all good. Again, thanks to everyone. Have a good day.